Hello, welcome to another episode of Walking Through Infertility. My name is Juliet Imo. Today we'll be talking about endometriosis. And we have with us a delectable Dr. Chinny, a UK-based medical doctor, extensive experience in gynecology. The exciting thing about having her on this program today or this episode is that she has a lived experience of endometriosis, and I believe she's a very perfect person to be telling us about endometriosis. So please join me to welcome Dr. Chinny as she introduces herself. Welcome, Dr. Chinny. Thanks for joining us today.
Thank you, Juliet. Very kind. Thank you. Hi, everyone. My name is Dr. Chinny Osy Eneze, and I'm a practicing general practitioner in the United Kingdom. But prior to being switching careers, that's something with time maybe Juliet and I talk about in this podcast. I was in obstetrics and gynecology, and I was there for about 10 years working in the United Kingdom with a greater percentage of that time doing gynecology. So I'm really, really grateful to be invited to speak about endometriosis. Thank you, Juliet, for having me.
Thanks, Chinny. Thank you very much for joining. And then I'm going to start. Let's just go straight to it, okay? I recently met a lady. Before now, I really didn't understand. I hear endometriosis, but I really didn't understand it. But I can imagine my shock when she said something that during her menstrual cycle, her monthly menstrual cycle, she gets to see blood coming out from her navel. That was a shock for me. Didn't know anything like that. So please, could you kindly tell us more? What's endometriosis? What are the symptoms? What is it, please? Thank you.
Thank you so much, Juliet, for that question. You know, people do not understand how devastating that clinical condition can be on a woman. So endometriosis is a chronic condition, which simply means that I call it rogue endometrial tissues, that's tissues of the womb, is found in places where they're not meant to be.
Okay.
The womb of the woman houses the tissue, that's the endometrium, which is what lines the womb. So the work of the endometrium is that it prepares the womb to welcome the fertilized egg to now carry the baby. But when fertilization does not happen, it sheds and you get your period. Okay. But in a group of women, that tissue, for some bizarre reason, finds itself on the ovaries, in the tubes, outside the womb, in the chest, in the navel, at the back of the vagina, at the back of the bladder, at the back of, you don't want to know. Wow. So when that person sees their period, those rogue tissues also bleed as well.
Wow.
And so, yes, and because it's in a place that the body doesn't want it to be, when your body dries up after your period, because naturally that place is not meant to house endometrial tissues. So what happens? They form, the inflammatory process forms scar tissues there.
Okay. Yeah.
And with those scar tissues, they start having pains. So for some people, the first thing they start experiencing is excruciating menstrual pain. And the pain is out of this world, I have to tell you. So now that pain is there because pain comes from inflammation. The pain is there, and with the pain and scar tissues, adhesions, and when the tissue is, say, in the lungs, like in my own case where it was, you will be bleeding in your lungs. You'll be bleeding.
Goodness.
You'll be bleeding through your back passage. You'll be bleeding through, bleeding through your navel, which is probably the case of the lovely young woman you talked about. So yes, that's how devastating. But some studies have talked about tissues even in the brain. So I kind of like liken it to a mini cancer because of the way it behaves, because it can be anywhere, but not cancerous because it's a benign clinical condition. So that's in a nutshell what endometriosis is all about. And because it's in all those places, depending, for some women, they might be asymptomatic because they don't know that they've got it, which means they're not showing any symptoms. So I
Oh,
always
really?
liken it, yes, I always liken it to something like autism. Autism is a spectrum from this end to this end. And that's the same thing with endometriosis. Is a spectrum. It depends on where you lie on that spectrum. If I have at this end, a person is coasting along, you only find out if they start experiencing fertility and you go look in and you find endometriosis. Whereas you find someone, because of where their rogue tissue is, during their period, they can't even pass stool because it's so excruciating. They can't even wee. That's about they can't breathe. They have breathing difficulties. So it depends on where you lie on that continuum. So wherever you find yourself, if it's behind the vagina, they want to call pouch of Douglas, you have difficulty having intercourse with your spouse. They have very painful sexual intercourse. So that even puts them off sex. So it's something that, it's a lived experience of women, let me put it that way. So those are the symptoms that you can have with endometriosis. Again, it can be in the wall of the womb, causing what we call adenomyosis, which means when you're bleeding, the wall of the womb bleeds inside the wall of the womb. It makes it bulky. Then the period becomes very heavy because it cannot contract itself, because your body stops bleeding with the ability of the womb to squeeze on itself to reduce the bleeding. But with endometriosis, because of how thick the walls of the womb has become, it becomes difficult to control the bleeding. So they have very heavy period. I do remember one time I was in the salon, what I had was, ooh, the whole sit in the salon.
Oh my goodness.
So it's something that is so, yeah, it affects your life so much that your social life, you're literally, your whole life is around your period, because you stop existing. You only have two off that time where you haven't got your periods, that you actually are a little bit relieved. And you now start a week to the period, start the apprehension, oh, I'm about to live through this again. So I don't want to start going on to so many things, but that's in a nutshell, Juliet, is what endometriosis is.
Thank you very much. Just back to something you said, like, I know that in Nigeria, most people say things like heavy bleeding, and they all think it's fibroid. Is there any chance that people might think what they're having is fibroid, but it's possible that it's endometriosis?
Yeah, heavy bleeding. The first thing to think about is fibroid, because that's the commonest amongst the Black ethnic minorities.
Okay.
But yes, unfortunately, with that fibroid might be coexisting endometriosis as well.
Okay.
So, and there might be, and you can only know when the gold standard, which is a laparoscopy, doing a camera to look in, that's when you pick up that endometriosis might be contributing to it. Yes, bleeding. Of course. Yeah, if somebody is having heavy bleeding and you check and there's no fibroid, if they also give you that symptom that they're having pains, unusual pains, during my period, I can't breathe. During my period, I can't wee. During my period, I can't pass even wind. Wind that you pass and your friends frown at you.
Yeah.
Endometriosis, you can't even pass wind because it's so painful. Someone should be also thinking in the line of endometriosis.
Thank you very much. Yeah. So talking about, you just mentioned the Black ethnic minority. That brings us to the risk factors. So what are the risk factors that could predispose someone to endometriosis?
There are a lot of things. I know popular people talk about diet, but with endometriosis, first thing is family history. Unfortunately, that if your mom had menstrual pain, the chances are that you're going to have menstrual pain originating from endometriosis.
Oh, really?
So family, yeah. family history. There is a family history of it, especially maternal.
Okay.
Then if you started your period quite early, say before age 11, that's a risk factor for endometriosis. If your cycle is short, which means you bleed too frequently, you have a short cycle, like some people, they two periods in a month.
Oh.
Yeah, so two people do because they have a very short cycle. Because in a month you have 28 days, sometimes 30 days, but some people they bleed like twice. So that's a risk factor. And if you bleed for a very long time, people bleed longer than 7 days, see people bleeding for 10 days, 14 days, 21 days. Those are the risk factors. And again, not having had a child. So we don't know if it's the chicken before the egg or the egg before the chicken. Infertility, the endometriosis that's causing infertility.
Oh,
Or
if
the
infertility. Oh,
that is caused.
really?
Yes,
Wow. Wow. The life of a woman.
I know.
So
I
these are
know.
all the risk factors, basically. It has nothing to do with race or doesn't, apart from that.
Yeah, there's some studies that seem to suggest is more commonly in the Caucasians, but I don't think so. I just think within the Black and ethnic minorities might not have been well researched.
Oh, okay.
Yeah, I do remember in med school, that was what were made to believe that it was mainly the Caucasians. But you and I
Okay.
know that might not be the case, just because the research has not a lot of research is out there within our Black and ethnic minorities. So it's difficult to tell, really. Until
Okay.
such studies are put out there, we can categorically say it has a race predilection to it.
Okay. Yeah, I remember when I met you in 2007, you were going through the phase. And I know it has something to do with your lungs, and you had like a
Yeah.
catheter attached to your lungs to do some
Um,
draining.
yes, I'm sure you don't want to go into my
I
story
don't
because
want to, but I
that will take
know.
up, but I'll just briefly talk about it. So, um, in my journey of infertility,
Mhm.
you know, I literally died during my period. There's sometimes when I see my period, I ask God to take my life because I don't want to live through it.
Wow.
When I see people, when I see people, they have their period, they're all, so for me, I just say, instead of me to go through the pain, I'll be short of breath.
Mhm.
And the unfortunate thing was, my doctor, I couldn't even work out what was wrong with me. I was being tossed to and fro, doctors. I was, during the course of my IVF, fluids were accumulating in my lungs, and they didn't even know what it was. And they were giving me yet more
Hormonal
hormones, which was worsening.
the
They
situation.
practically destroyed my lungs in Nigeria. But that's the story for another day. They treated me for TB for 9 months
Wow.
because when they do imaging, my lungs are filled with blood and they think it's TB. Could I have TB? So it was just one amazing doctor that was able to make the connection that this thing, the blood accumulates when your period comes.
Oh,
Maybe
yeah, yeah, yeah.
maybe there's a link. And that was why I started doing some digging myself. It's quite a rare form of endometriosis. It's called catamenial endometriosis. So
Oh,
then what now used to happen was anytime my period came, I would have to go to him to drain the period fluid so
from the
that
lungs.
yes, I'm able to breathe normally. So there's a whole lot to unpack about my story with that respect, but we'll get to it at some point.
Okay, so from what you're saying, it seems it's not easy to diagnose endometriosis. Because come to think about it,
Mm,
just 1 minute. I recently watched a clip on CNN where a lady, she's a writer, I think she's late now, she said for years, even in the UK, it was a bit difficult for them to tell her what she was
yeah,
suffering from. So tell me,
yeah.
is this changed now? Is it still difficult to diagnose? And how do
Um,
you diagnose it?
First, I'll start from it being deemed as a weak woman's problem because people looked at
Weak?
menstrual pain. Yeah, yeah, they've looked at menstrual pain. Oh, there's nothing. What is menstrual pain? No,
Oh,
What is a menstrual pain? What you suck it up. So when you present to the doctor, the first impression is this is just menstrual pain. Why can't you deal with it?
wow.
What is wrong with you? So your life starts out that way. You're trying to explain to someone that something is not normal here. It's not normal that I should be living in pain. You have to take time off work because you cannot function within that period. And everybody sees you as a lazy person. You're not, how come every other person in your unit is having that period? What's so special about your period? So you start with, unfortunately, some clinicians, especially our male counterparts, that can't relate to what you're going through. They
Mhm.
start out with thinking, are you malingering? Are you trying to be funny? So with that mindset, you're not even listened to.
Oh,
Okay?
sad, sad.
Be you in America, be you in UK, wherever you are, you're not even being listened to because no one can understand what you're going through. So it will take, in fact, it's something that I think I should share. Sometimes in hospital, they see you as, oh, she's come again. Because, yeah, she's come again because she's
Well,
wanting some particular painkillers, but not understanding
that you're
the
actually
depth
going
of
through pain.
pain the person. Yes. So what happens with that mindset, before anyone can even begin to think about helping you, the devastating effect of the endometriosis has destroyed your organs. So by the time people wake up to it, yeah, it's done so much. And before you get help, that's just it. And again, it's difficult for people to relate your symptoms to your period. It only takes a doctor that is interested in your story that will pick up on the fact that this bowel symptom that you're having is actually related to your period. This shortness, I told you in the UK, I had so many fancy things done on me because they didn't understand that the pathology of what was going on with me. I went to one of the best hospitals in the world in the UK.
And
I
yet
don't
it
want to
was still
mention the
difficult.
hospital.
And yet it was
Yeah,
still difficult. Yeah,
it was.
that
I
particular,
went to
sorry.
a fertility specialist in Nigeria. He couldn't even work it out. So unfortunately, sometimes you need to take your health into your hands, do a bit of research. So it was in the course of digging and digging that I got to understand what was going on with me. And with it, I was able to help myself. I actually got them to discharge me from that hospital that looks after chest. Yeah. Because I was just going there. I'm like,
Mm.
so by the time I got to know, I just, until today, I never went back because I understood what was wrong with me. Okay. So I was able to take my life in
Actions.
my own hands, which is why I'm doing this, hoping to empower women because there might be a few women trying to get the attention of their doctors. Look at what I'm going through. So through this podcast, I'm hoping I should be able to help one or two people.
Thank you very much for joining us. This is actually the whole reason for this podcast, hoping to share information that women can use to help understand their body and actually do what they're supposed to do. So again, let me take this time off now to say, if this is something you think might benefit somebody you know, please get them to subscribe to this channel and then share the link, leave your questions. I'm sure Dr. Chinny won't mind coming back again to join us to share more light. If you have direct specific questions you would want to ask her, please do leave your comments and reach out to me on jujuemo@gmail.com, and I would always get Dr. Chinny to respond to you. Thank you very much. So moving on, there was a comment you made earlier on where you say you don't know if it's infertility that causes endometriosis or endometriosis that causes infertility. Could you tell us more about this? Is there a link? Does it stop women, or is it
Yeah.
the cause? Let us know, please.
Okay. Yeah. Endometriosis, unfortunately, can cause infertility in so many ways.
Okay.
The first thing is it affects the quality of your eggs.
Oh, okay.
Yeah, because those rogue tissues,
Mm-hmm.
you know, they release toxins,
Okay.
unfortunately, yeah. So it affects the egg quality. So even if you're going for IVF, fertility treatment, you're
Mm-hmm.
advised to go through a laparoscopy, which is a camera to look in and burn off some of those
Rogue
endometriotic
tissues.
tissues.
Okay.
Yes. Yeah, because it can affect the outcome of your IVF.
Okay.
And endometriosis, if it's in the tubes, it can cause inflammation, as I said, scarring, which means the tubes will be no good. So if the tubes are no good, fertilization occurs in the tubes. So it's unlikely you're going to fall pregnant.
Oh.
Okay. And even if you manage to fall pregnant, the chances of having an ectopic pregnancy, because the integrity of the tissue is not the way nature has intended it. So you can fall pregnant there, and because the nature of the tube to move the fertilized, the embryo now down to be implanted,
Into the womb.
yes, it's compromised. So the chance that it will get stuck there and ectopic pregnancy can occur, which is a pregnancy in the tube, you know. And sometimes because of, I talked about the quality of the endometrium is also not optimal
Okay.
because of endometriosis. So what some fertility specialists tend to do is they give you medication to like quieten your period, stop your period
Okay.
for a couple of months so that
Okay.
your body will be, stop those rogue tissues stop being active, which
Okay.
gives you a good chance of a better outcome. So that when you're stimulated, you can imagine, because those tissues feed on estrogen,
Yes.
they feed on estrogen, and here you're going for, IVF without sorting those things out, and you're firing,
Estrogen.
which was what happened to me in Nigeria. And you were firing with those
Hormone
medications.
switches.
What will happen to those tissues? So you need to keep them down. When your treatment starts, they're less likely to be active. So which gives you a better chance of a successful IVF.
Okay.
And yeah, and sometimes they form scar tissues, in the way that when you want to, let me say, if you manage to carry a pregnancy, during surgery, it becomes difficult to do things like a cesarean section. Yeah, because the scar tissues, the scar tissues are
Really?
all over the place. Your bladder, like when I was having my C-section, I told the guy called the obstetrician that my bladder is going to be stuck to my uterus. And he was like, "How did you know?" Because when you opened up, that was what it was. Because you could have your bowel blasted at the back of your womb. It could, so it's not
This,
a surgery for the faint-hearted.
this is
Yeah,
scary. It's
that
scary.
is not scary. It's not scary. I'm a testimony.
Yes,
And
you are.
again, when you have the baby, the
Mhm.
womb will struggle to come together, and you're at risk of postpartum hemorrhage, which is that excessive bleeding
Yes.
after you've had the baby. So it doesn't just stop with trying to conceive. It doesn't just stop with carrying the pregnancy. It's also that issue of when you've had the baby controlling the bleeding. But it's not all gloom and doom. The beautiful thing is if you succeed in falling pregnant, you will keep the tissues quiet for the length of time because you're not having your regular periods anymore,
Oh,
you
okay.
know?
Okay. Okay. Okay.
Yeah. And there's
That's
a chance, yeah, it's not all gloom and doom. And there's a chance that with that being quiet for a while, hopefully that should improve your life after you've had the baby.
oh,
But
awesome.
unfortunately, for some people, once the period starts, that will start. But for some, being quiet for that length of time keeps you quiet forever.
Awesome.
Yeah.
Awesome. So, so from what you're saying, there's a possibility that a woman who presents with endometriosis can actually go ahead to have children if she wants.
Yeah, of course. Why not? First, there are things that can be done. As I said, is not all gloom and doom.
Okay.
First is, I think, is when you've got um, menstrual pain that you can't get on top of. You take your usual ibuprofen or mefenamic acid, your usual painkillers, and you can't get on top of it. And it's controlling your life. That's the key word. Your life now circles around your period. You're unable to live your life. You should ask questions. Don't keep bearing it and thinking, oh, it's just probably menstrual pain. Because by the time you wake up to it, your inner structures have become, a bit compromised. So present yourself to the gynecologist and get them to offer you a laparoscopy. And the errors I made back then was I was offered to be put on the pill. You can have the combined pill.
Okay.
I was offered some injections to shut the ovary down.
Okay.
Yeah, because in my panic, I felt if you stop my ovaries from working, are you sure you're going to restart it again? Because what the aim is to keep your body quiet enough. You don't have any periods.
Okay.
Your body stops bleeding for a while to allow those tissues to try to, heal itself if possible, to keep things quiet for a bit.
Okay.
So there are things that can be done. And when you have menstrual pain, try and take an anti-inflammatory. At least it stops that cascade of inflammation that predisposes to scarring within the internal structures of the body. Okay. So the laparoscopy, what they do, that camera, we call it camera, they just put a camera. It's a day procedure. It's something that you can do same day and go in good hands. They were just looking, but it needs to be a good laparoscopist, because if yours is the silent one, that you've got what we call a frozen pelvis, that is quiet, doesn't mean the impact is less. It might be quiet because the scar tissue is so much that everything is contained in one pocket. So it's what they call a frozen, yeah. So the person scoping, when they put the scope, they need to be careful, because it might have something like the bowel stuck up onto your navel.
Okay.
So someone that is not careful will go through your bowel. So it's a surgery that you need to go to a very good unit for. So when you put a scope in to look around, if there are any tissues, it needs to be burnt off. Okay. They will burn them off. But unfortunately, sometimes when you look in, you might not see anything. That you didn't see anything doesn't mean
it doesn't exist.
It's not endometriosis.
Okay.
No.
Okay.
It might just be that the person is scoping, because you can't see everything.
Yeah, I understand.
Which is why some people, what they try to do is put you on the pills, like I've said, try to stop your period. If your symptoms improve with that, they'll say, bang on. This is, because you can scope. I not find anything because there is one rope, tissue somewhere that you haven't been able to look at. I don't know how much time we've got, Juliet.
Okay. So what we're going to do now is maybe let's just ask one other questions. So apart from this, what other help, apart from the laparoscopy, is there any other thing a woman needs to do to manage her symptoms? Diet, any other thing?
Okay, I researched then into a couple of things. I read a lot of
I remember you used to drink goat's milk instead of cow milk. I remember there was a time you used to do that, right? But did it help?
I did all sorts of things, but what I found most helpful, first, the support groups is very important, because it messes up with your mental health as well. Okay. So I would advise a support group. There are always support groups, the right support group, and there's Endo Sisters. I'm not advocating for any particular group.
I understand.
Any group that you find that meets your need. So, because it's quite supportive when you chat to ladies that have got the same lived experience as yourself. So to make you understand that you're not alone in this journey. Because sometimes you feel alone, isolated, and you feel, oh, why me, God? Why me? It's not just true. There is always support out there. And that's why we're doing something like this. So a support group, that's one. Two, you talked about diet. So in my course of reading, I was able to come across meals that are estrogenic. So there are certain foods that you eat that produce what we call phytoestrogen. I'm not a dietitian, I must declare that. So there's that book. I don't think is evidence, but whatever works for one is that if you feed on certain foods that have estrogen in it, that it might feed the endometriotic tissues. That's that anecdotal belief that when you eat certain foods, so I haven't got on top of my head, maybe in our next chat, I would be better prepared for it. There are certain foods that if you eat, yeah, it will kind of like worsen the endometriosis. There are certain foods that if you eat, it will improve it. Like they talk about yam, wild yam is called. Wild yam is progesterone. I'll get a lot of it in the Yoruba land, which the evidence has suggested there. That's why Yoruba people tend to, a lot of you are interested in this one. So that wild yam, they say if you take it, because it's progesterone, it tries to calm down the effect of the estrogen feeding of these tissues. So I think on this one, I would like to talk about it because I would like to give appropriate information. And besides, I need to pick my little one.
Okay, thank you. Thank you very much. Thank you. So in general, is there anything you just want to throw out there for women who are going through this? Anything to encourage them, please?
Okay, first, Juliet, thank you really for this opportunity. I've never actually, a lot of people have encouraged me to talk about my journey. So I'm grateful to you for encouraging me to do that. I didn't think I would talk much about it because I'm social media shy. But what I want to say is the doctors said I couldn't have a child, but I want everyone listening to the podcast to know I have a 9-year-old daughter. Okay, there are no impossibilities. Never accept that you cannot have a child. I say it and I say it. The only person that can accept defeat is you. You need to make up your mind that because you're made in the image and likeness of God, and there are no impossible. I tell you, I kid you not. My story has inspired a lot of women to go on to have not just one baby, twins. A lot, 2, 3 of them. There is always hope. Don't give up hope. Do not. God is there for you, and we're here as well. Juliet and I.
Thank you very much, Dr. Chinny. I'm really grateful. You're actually my first guest on my channel, and I look forward. Yes. And I look forward to more engagement in the future. So thanks for joining us. And guys out there, this is a community, and we're trying to build up a community where people will feel safe to talk about their experiences, to ask questions, and then just to learn. You've heard from Dr. Chinny. She went through this both as a medical doctor and a living experience and testimony of a woman who has gone through endometriosis, still went ahead to have a baby. So please, just know that you're not alone. Don't kill yourself because of this. Learn what you can learn, gain knowledge, gain support, stand up there, brace up for anything, but please don't give up. Thank you once again for joining us. I look forward to another time. And please do share this link with people who you think might need it. Subscribe, leave your questions, leave your comments, send me an email, and hopefully we'll be able to come back and do this together. See you again next week. Bye. Thank you. And God bless.
Thank you so much.
Thank you. Bye.